I've been asked to give a bigger context for this that you may find quite different than what you just heard. That is, we are at a fork in the road. And we are at a fork in the road in which we need to change and evolve our practices for the 21st century. And we need to take advantage of these opportunities through collaboration with other disciplines and the integration of scientific and technological advances. One of the big forks in the road is the fact that we had healthcare reform this year. And healthcare reform this year focused on 4 areas, and I'm going to just briefly talk about a couple of them. First of all, there was the issue of increasing access to care, and there are going to be more people that haven't perhaps been able to see us who are going to now be able to see us. There is creating a 21st century healthcare system, revitalizing primary care, which is a huge component of creating a 21st century healthcare system, and comparative effectiveness research to drive practice, which I'm not going to speak about here. The 21st century healthcare is interdisciplinary teams, care management, care coordination, quality assurance mechanisms, health information technology systems that are supported to supposedly lead and improve quality of healthcare and ensure better access. Now, the second component of healthcare reform is the revitalization of primary care. And there is a model for this. It's called the patient-centered medical home. How many of you have heard of it? Most of you here. If you haven't heard about it, you should learn about it because it's going to be where you're going to get your health care in the future. Patient-centered medical homes, this is the definition, are by physicians, and I prefer the term patient-centered healthcare home, but the train's out of the station on this one, is a personal, everyone should have a personal physician. It should be a physician-driven practice. Sounds like political to me. Whole person orientation, which is what this symposium is all about. A place where care can be coordinated and integrated, make sure that there's quality and safety, and that people have actual access to health care, and that there's payment reform. One of the issues in primary care is primary care specialists overall are the lowest paid physicians. We're talking about family doctors, pediatricians, and general internal medicine. And part of what they look for is payment reform, which happened in healthcare reform. Our president supports this idea. As he says, I support the concept of the patient-centered medical home as part of my healthcare plan, including physician-directed interdisciplinary teams. Now, the model for this is what's called Transform Med. This is a very busy slide, as you can see, and it talks about all the different pieces. I don't have a little pointer, but I would encourage you to try and see if you can see behavioral health in there anywhere. It's actually about right there. One little line out of this whole big picture. And last year as president, when I was invited to join this group to talk about how behavioral health needs to be an integral part of the patient-centered medical home, because physicians who were not part of the lead group of this said, you can't have a comprehensive whole-person place unless you talk about behavioral health. Simply can't have it. So the program is now looking at models in which behavioral health are fully integrated into the patient-centered medical home. And this presents some great opportunities for us to be involved. Most psychologists don't practice in primary care at all. Most of us are in independent practice and mental health care. So this is a real paradigm shift for us to consider in the future. Now, why is it that we need to do this? Well, there's clear data about this. This graph shows, this was from the Prime MD study that psychiatry developed a measure to look at mental health symptoms in primary care. They tried to develop this tool called the Prime MD, which didn't really work. But what you see from this data is that the more physical symptoms that people have, the higher probability that they're going to have a mental diagnosis. So somebody who has 6 to 8 symptoms has almost an 80% chance of having a mental health diagnosis. We also know that comorbidity is also the story. Again, in this slide, what it shows is that if you have a physical health problem, such as heart disease or diabetes or high blood pressure or asthma, if you have a comorbid mental health problem, it costs a lot more to treat. And that if you do not treat the mental health problem, for example, if you have diabetes, type 2 diabetes, if your depression is not under control, you simply can't get your diabetes under control. And we now know from some research that was published in JAMA last year, the physiological mechanism of that. Your hormones don't work properly when you are depressed and have diabetes. And until you get your depression under control, you simply can't treat the diabetes properly. So we're beginning to understand these mind-body links and why it's so important that you talk to and take care of behavioral health. We also know that if you look at the determinants of health, that 50% of the variance is due to health behaviors, lifestyle, what you do, how you feel, how you take care of yourself. It's the largest portion. Genetics is actually about 20%. If you look at the NIH, you would think that it's 90%, but it's not. Most of this is lifestyle issues, and particularly when you're talking about chronic disease like cancer, like diabetes, like high blood pressure. Again, people who don't take care of themselves overall, their mental health, their physical health in terms of lifestyle and diet, simply are not managing their chronic illness very well. We also know that people who have a mental disorder are much more likely to die early. On average, people with a serious and persistent mental illness, on average, die 25 years younger than somebody who doesn't. And that the causes of this are primarily health behaviors. When you are depressed or you have a bipolar disorder or you have anxiety, you don't take care of yourself. And you're more likely to die young. So these are all reasons why we need to be involved in health care, not just mental health care. And the techniques that you're going to hear about in this symposium are wonderful techniques to help manage these kinds of issues in the health care. Now, in the health care reform bill, there were two important things that are going to support this change. Number one is we had the parity bill that actually occurred before health care reform. That was in 2008. And by the way, the parity bill is now the law of the land. It went into effect July 1. And if you're in practice and you have issues with insurance companies where they're denying you coverage, you need to tell them, look, what about parity? There's no limits to number of sessions you can provide people anymore. But insurance companies aren't abiding by that, so you have to challenge them a little bit. But the parity law was included in health care reform and it was actually strengthened. So it means that in this comprehensive health care reform where they're looking at, and they use language like whole person health in health care reform bill, that we now are centrally part of that. We also know that there's a big move to integrated health care. Integrated health care using the patient-centered medical home model. So that's why it's so important that we as psychologists learn about it, because we are going to be impacted by it. We may choose not to participate, which I think is a mistake, but we are going to be impacted by that. And we know that in the law, psychologists are mandated to be part of the benefit package. The APA, in our lobbying efforts, did a remarkable job to include us everywhere. Not just mental health, but it explicitly says, in many cases, psychology, which is a very important change for us. And the other big part that is part of healthcare reform that hasn't gotten much press, but it's a game changer, is they're not going to pay for preventive services. And again, a lot of the things that we're talking about here are preventive services to help people not get sick, to not progress down in a more unhealthy way. But these are things that are now going to be reimbursed. And so if we get paid to do them, then we're more likely to do them. So prevention is a key factor. The Obama administration really got this. Now, one of the things that I did as APA president last year was I had a task force on the Future Psychology Practice Initiative. I'm just going to mention it briefly. We looked at how we can change practice in the future, and use some of these ideas around healthcare reform to develop partnerships and look about promising our agenda. One of the task force recommendations is around developing psychological models for integrated and primary health care, making sure that we're included. We need to have tools. Most of us as psychologists are not trained to work in primary care. It's a different way of practicing. You have to have special skills and knowledge. And that's about all I'm going to say. If you'd like to know more about it, you can come to the next, after this symposium, we're having a symposium on the Future Psychology Practice Initiative at 10 o'clock, and we would welcome you to come and hear a full presentation about that. So with that, I think I hope to have a bigger context and why what we're talking about here and the skills that we're talking about are going to fit with that future perspective that we all have, that we're going to need to change and evolve to in the future as we provide psychological services to our clients and patients. Thank you very much.